Hello, my name is Hannah Shuffer, and I'm a rising sophomore at Duke University. And this summer, through the Wong Fellowship Program, I was able to intern at the Margolis Center for Health Policy. I worked with my mentor, Dr. Janet Prubetker, and looked to see if patients who report as Hispanic and most comfortable speaking Spanish as their primary language are disproportionately referred less to a community resource navigation program than patients who report as non-Hispanic and English speaking. To give some context, as can be seen in the flowchart in the left column, Help Desk, which is the name of the Community Resource Navigation Program, works by having case managers at a federally qualified health center screen patients for unmet social needs, then refer those patients to community resources. And finally, the case managers get to decide whether to refer the patient to Help Desk or not. If the patient is referred to the Help Desk program, then a student volunteer makes follow-up calls to either make sure that the patient was able to connect to the suggested resources, or if the patient had any problems, help them connect to the resources. This is great. However, due to language and cultural barriers, Hispanic and Spanish-speaking people tend to have poor patient-provider relationships, which results in the provider not fully understanding the patient's situation, and in this case, potentially not referring them to the Help Desk program. For this retrospective cohort study, the data consisted of a total of 787 patients that were screened at the health center and had the potential to be referred to the Help Desk program. Due to ongoing data cleaning, all of these results are preliminary. In order to better understand our population, the first thing we looked at was the breakdown of the population by ethnicity and language, which, as can be seen in Table 1, informed us that most Hispanic patients are Spanish-speaking and most non-Hispanic patients are English-speaking. Ultimately, as can be seen in Table 2, we looked to see if there were any differences in referral by ethnicity and language. Although this is preliminary data, these results show that Hispanic and Spanish-speaking patients were disproportionately referred less to the Help Desk program. In order to eliminate this disparity, our recommendations are to inform the case managers of the disparity so they can be conscious and proactive when they're interacting with the affected patients. Furthermore, implementing cultural literacy training would help to improve the patient-provider relationship so the provider will better understand the patient's situation. Finally, establishing clear guidelines for referral will decrease any ambiguity regarding who is eligible for the Help Desk program. Currently, our next steps are to perform our analysis with the clean data, determine which patients were seen by bilingual and bicultural case managers, and examine the characteristics of the various subgroups in our population. I would like to thank Duke University Help Desk, the Duke Mass Connections Program, Lincoln Community Health Center, the Margolis Center for Health Policy, and the Wong Fellows Program for making this project possible. A special thanks to my mentor, Dr. Janet Prubetker, for taking the time to teach me essentially everything I know about health policy and the social determinants of health, and guiding me in this project. I would also like to thank Eileen Wen for her help and Albert Ranku for performing the statistical tests. Thank you for listening.